Everyone. Welcome to Parul Institute of Public Health's webinar series on public health and health administration. I am Dr. Apurva Kumar Pandya, a director at Parul Institute of Public Health. I am happy to share that today we are going to talk about health technology assessment for evidence-based decision making. Now, this topic has two major components. One is health technology assessment and another is evidence-based decision making. Evidence-based decision making is a process of utilizing all available evidences for making policy and programmatic decision making. Today we will be our expert will be talking about how health technology assessment can promote and help in evidence-based decision making. So we have with us Dr. Salu Jain, who is one of the expert in this area, and she will be talking about health technology assessment for evidence-based decision making, national and global scenario. So before we begin, let me introduce our expert for today's talk. Dr. Salu Jain is a senior consultant for research and evidence synthesis in public health and social sciences with extensive experiences for more than 14 years in both academic and economics, health finances, and policy making settings. Her research interests include evidence-based decision making, health economics, health financing, with particular focus on social determinants of health. She has completed so far numerous research projects with some of the organizations both within and outside India. She had the privilege of working with Government of India organizations, including Department of Health Research, Ministry of Health and Family Welfare. She has also worked on different projects with NICE UK, HITAP Thailand, and Euroqual Foundations from Netherlands. Now, currently, she is working with Campbell Collaborations, which is UK-based institution. I hearty welcome Dr. Salu Jain, and I hand over this webinar floor to Dr. Salu Jain. Salu Jain, over to you. Yes.
Apurva, can you see my slides?
No, actually, your screen is visible, but presentation is not visible. So when you click on it,
is it visible now?
It is visible.
Oh, thank you so much. Thank you so much. And I'm so sorry for this initial technical glitches which came for sharing, and I don't know what happened, but I'm glad that now you can see it. And thank you so much, Apurva, for providing me with this opportunity. Like one-to-one interacting with students, this is something I really enjoy, like interacting with them to see what all ideas they have to improvise the public health, and also that what they want to do after completing their courses is something very interesting. I would like to interact with them more at the end maybe. So let's begin without wasting much for the time, because we have wasted a lot earlier. Indeed. So a brief overview about what all we are going to include in the presentation. Purva, one thing that I cannot see any of the participants, neither of you. I can only see my presentation. If there is any question, if you want me to stop in between, if there is any question in between, I would be very happy to take that. So please stop me whenever you want to.
Yes, Dr. Salu Jain, I will be moderating question and answer from participants. So I will be coming in between if there are questions. Otherwise, we usually have question and answer session after the presentation at the end, so that it basically it helps us. And you won't be able to see faces of all, because usually we request everyone to keep your video off, so that we can utilize internet resources better, because there are some internet issues faced by many of our students. So let me give little background of our students and institute.
Yeah, sure.
That may perhaps help you tweak your presentation and provide some information. So, Parul Institute of Public Health is a constituent of Parul University, established in 2016, and we do offer Masters of Public Health courses, Bachelor of Public Health, Masters of Health Hospital Administration, and PhD. We have around more than 180 students in different programs, and our students are from different parts of the country as well as different countries. So we have students from Nepal, Bangladesh, Afghanistan, Ethiopia, Ghana, and different part of our country. So we do have multicultural students here, and we are also,
Are they there like physically, or they are taking online courses, or they are just studying from their own country?
yeah, so we do have regular courses, so they do come here and study, and our PhD program has part-time component. So where they have to come to our institutions, but they can remotely they can work and
Okay,
pursue their program part-time.
perfect.
Otherwise, we do have regular courses, and they do come here. And
Great.
we do have a work integrated program where those working professionals in the health and allied field, they can also opt for WAP program, where they only have to visit twice in a year, and all the courses are run online. And now this month onwards, we will be having on-site classes for those students who are enrolled in work integrated program.
Correct.
Yeah. So I think this will provide you basic overview of our students. And for this webinar, we have students not only from public health, but from other departments and institutions of Paro University. And it is open for all, because this program is live on Facebook. So those people who are interested, they would be also joining. So
Indeed.
I will be moderating question and answer session from them.
Sure, sure. This was
All
very
right.
helpful, Apurva, to know about the background of students. And I also kept the presentation like very basic, and it is like very general kind of, nothing very specific. So I kept it basic so that everybody can understand and have an overview. But if there are any specific questions on anything in particular, very specifically about the HTA techniques and what all, if they are interested, if there is any question, I would be very happy to take that also. So I'll
Great. Thank you.
give an overview what we are going to talk about. We'll talk about what HTA is, why we need it, and how all we are using the HTA technique, some global usage we'll see. And we'll also see what are the international HTA organizations which are dedicatedly working in the field of HTA. And then we'll talk about the latest developments which are happening in our country around HTA. And as there are mostly students, I thought this would be interesting to talk about the career opportunities in this field. If they want to know what all they can do in this field after completing their
So,
course, I've just kept a
and
session.
it is open.
Sorry.
Yeah, yeah. Please go ahead.
Yeah, so I kept it at the end, so we will just have some time to discuss that also. So let's just begin with the main content, which is HTA. So before moving into what HTA is, let's see what health technology is. Before before knowing what health technology assessment is, let's see what health technology is. So when we say health technology, don't assume that we are talking about anything very fancy. Like we are just talking about the big instruments and equipments and gadgets. Health technology is not just that. When we say health technology, it can be a very simple thing also. It can be as simple as how you administer a drug. Whether you are going to administer the drug by using an injection, or you are going to administer it by using an oral pill. It can be as simple as that. You can compare these two things. These two things can be your health technologies. The World Health Organization has come up with a very holistic definition of health technology. So they say that the health technology is anything. It can be the application of organized knowledge and skills in the form of medicines, medical devices, vaccines, procedures, and systems developed to solve a health problem and to improve the quality of life. So they say that anything that can solve a health problem and anything if it is improving the quality of life, that can be considered a health technology. So within health technology, within HTA, a health technology can be a drug, it can be a device, it can be a policy question. You can have a question to determine whether this type of a policy program will be more cost effective versus that. It can be a medical procedure. You can see whether this type of procedure for treating a health condition is cost effective versus a different type of procedure. It can be a diagnostic thing. It can be a screening thing. So your health technology can belong to a vast range of things. Moving to what health technology assessment is, what we when we say assessment, we know that we are going to evaluate something, and how we evaluate one thing against the other. So this is something you must know about HTA, is that when you're conducting HTA, you must have two or more than two things that you can compare. So whenever you are assessing or evaluating, you will evaluate something against something else. It's a relative term. So you compare two or more than two things in terms of two components. These two are a must within the HTA. You can have n number of other things also within HTA, but the two which are most important elements of any health technology assessment is clinical effectiveness and cost. What is clinical effectiveness? When we say clinical effectiveness, we see how effective sorry, how effective your technology is in terms of their clinical efficacy. For example, if you are using anything for treatment, you want to know how effective it is, how good it is in terms of reducing that. If you're taking a painkiller, you want to know how effective it is in terms of reducing your pain. So that is clinical effectiveness. And then you also need to know what is the cost of all these technologies which you are comparing. How much the cost of this versus how much the cost of that. So you need to compare clinical effectiveness and cost. And combine when you combine these two things, the clinical effectiveness and cost, you give this is called cost effective. This is called cost effectiveness. The clinical effectiveness plus cost becomes your cost effectiveness. And when we say health technology assessment, this is not just an economic evaluation. It can have n number of other things also to be assessed within a comprehensive health technology assessment study. You will also need to look into if these technologies are feasible, because health technology assessments are not just academically oriented studies. These are mostly policy oriented studies. These are the studies which are mostly commissioned to answer a policy question. So the decision makers are having a question and they want to use your information by the HTA, that whether this technology is effective, cost effective, whether they should reimburse this technology or not. And for that, they are not just interested in cost effectiveness. They would also like to know if that technology is feasible also or not, if this is equitable or not, if this is ethical even or not. And they would also like to be interested in budgetary implication, how much burden in terms of cost, in terms of budget it is going to produce if they are going to take a decision of adopting that technology. So what we do in economic evaluation is that we compare the inputs versus the outputs. What are the inputs? Our inputs are costs, all type of costs which are going to be incurred by using this technology will go into the cost. So these are the resources which are going to be consumed, and we compare this against the output, what we are going to get by spending this much of money. So that is the output. What are the consequences of using this? These are the effects. So it can be positive also, it can be negative also. We don't always call it health gain, because the health technology is not always going to produce a health gain. There can be negative outcomes also, there can be adverse events also, there can be side effects also. So your consequences can be positive, it can be negative also. So you will need to compare the inputs against the output, and you will compare these two against something. So I'm just repeating that when you conduct HTA, you need to have two or more than two things to be compared. But there can be situations where you don't have multiple options for comparison. For example, there is a health condition for which there was no treatment earlier. But suddenly a company came up with an innovation and they say that this was not treatable earlier, but now we have a treatment option for this. So in this case, how will you compare this? And you will compare this against what? In those situations, you can even choose no treatment as a comparator. So before this, in most of the cases, your comparator is the current practice. What is being used currently as a broader practice is your most important comparator. And if the current practice is no treatment, then that becomes your comparator. So, not having any treatment will also have a cost because people will not get treated. There will be mortalities and other disabilities that will also incur a cost, and that will also have health effects. So, by having no treatment, also you have cost and effects, and when you have a treatment, that will also incur a cost, and there also you will have effects. So, you will compare no treatment versus this treatment, and if you have something for being used for the treatment, then you have treatment A option and treatment B. So, like that, you compare health technologies within health technology assessment. Economic evaluations can be of multiple types, but there are four most basic type of economic evaluations which are used. First is cost effectiveness analysis. So as I said, within economic evaluations, you compare costs and effects of two or more than two technologies. So cost is always cost, you know, it will come in monetary units, but effects can be seen in multiple ways. So to see the effects of a treatment, of an intervention, you can choose a natural unit also, but you can choose a generic unit also. So when we do cost effectiveness analysis for measuring the effects, we choose natural units only. For example, how much pain is reduced, how many lives are gained, how many disease events are prevented. These are the natural units. But these type of studies have a restriction that you cannot compare different type of health condition. You can only compare the treatment options within one particular specialty because you are choosing very specific type of effects. Second type of economic evaluation is cost utility analysis. Cost is always monetary units, but in this case, you will have the generic units to measure the effects. For example, you can choose to have quality adjusted life years or disability adjusted life years. These are the generic units, and the good thing about these units is that you can now compare any type of health condition versus any other. So these are generic units. You only need to know how many queries are generated by this technology versus this, and you can compare the treatment. You can compare the cost effectiveness of treating breast cancer versus cost effectiveness of treating, let's say, diabetes. So these are two very different health conditions, but because you are using generic units of health effects, you can compare the benefits out of these two things. So that's the beauty of using generic units for measuring effects. Then you can have another type of economic evaluation. This is called cost benefit analysis. How we do that? In this case, we convert the effects also in terms of monetary units. So both your cost and effects are now in monetary units, and you will tell are the benefits worth the costs. So by using this, you can inform the policymaker how much benefits are being generated by using one particular technology. Then the last type of economic evaluation is cost minimization study. So what this type of study is, this is basically the study where the effects are same. So no matter if you're using technology A or technology B, the clinical effectiveness of both the things are same. So you don't have to compare the effects. You only comparing the costs. So whichever is cheaper is better, you know, because the effects are same. So whatever comes with lesser price will be a choice. So these are the four types of economic evaluations we can choose to have within our HTA studies. So what all you can use the HTA for? So for HTA, you can provide the information on safety. You can also look into the quality. This can also inform you about the access to care, available technologies you need to know, because to compare your intervention, you need to know what all options are there in the market, and you should ideally compare all of them against your comparator to provide the most informed decision. And cost effectiveness, of course you will see the cost effectiveness, and then depending upon the scope of that HTA, depending upon the requirement of the policy maker, depending upon the question what they have, you can also look into the legal aspects, the ethical aspects, and the social things, all that. So the scope of any health technology assessment, mostly it depends on what is the question, what is the demand coming from the stakeholder, what the user want to know. So as I said, HTA is mostly the most basic function of HTA is to inform the policy decisions. So depending upon what the question is, your scope of HTA can be set accordingly. So let's see what HTA involves, like what all we need to do when we are conducting a health technology assessment. So the economic evaluation is something very basic that will come with every HTA study. What we do in economic evaluation, we have seen that we compare the cost and gain of quality of life in case of using a health technology. So we compare the incremental cost. What is incremental cost? This is the difference in cost. So we are comparing two technologies, and we have cost of A minus cost of B. That is our incremental cost. And we have the gains in technology A minus the gains in technology B. That becomes our incremental gain. So we have our incremental cost divided by incremental gain. That is how we get the ICER value. What is ICER? This is incremental cost effectiveness ratio. So what this value means to us? This value means this much of money we will have to pay for having one quality adjusted life year. This is our value. This is the money we need to spend for gaining one quality adjust. That's the ICER value for that's the ICER value associated with this technology. So by conducting a health technology assessment, you will have an ICER value for that technology, and you will inform the policymaker that if you want to go with this technology, you will have to spend this much of money for one single query. So how you will have all this information? You can get the data on cost and effects by published literature. So for that published literature, you will need to conduct proper systematic reviews to see if you have information available on cost and effects or not. For that, you can look into the published literature, grey literature. You can have the records, the government data, the HMIS data. You can go to hospital registers. So all these are the sources of information for conducting your study. And there could be a case where you don't have the information you require for your HTA from the published or grey literature. So in that case, you can go for primary. You might need to go for the primary data collection also. So if there is no cost study available for your intervention comparator, you will have to go for a costing study to see how much cost it is incurring. And if you don't have a quality of life data, you can go for conducting your own primary study to see how much quality of life is being gained by the intervention. And likewise, if you have a diagnostic thing, you will need to go for the validation study to see if it is useful or not. So if you have studies enough information, you can go for secondary data. If you don't have, you can go for primary, and you can have a mix of them also. If you have some data available through the literature, you can use that, and whatever is missing, that can be collected through primary data. So it depends on what your study is and how much information is there. So you need to look into that. Let's see what we need HTA for, why even we need to conduct these HTAs. So the most basic reason why most of the government agencies are now using HTA is because many of the country governments are now committed for providing universal health coverage. What is universal health coverage? What it says? it says that every single person of the population, they should get the healthcare services without suffering financially. This is what the WHO says. So when the people don't suffer financially, that means they should get the healthcare services mostly free of cost. This is what the governments are committing towards. And because we know when we say population, it is huge, and every government will have something, a limit of resources for spending in healthcare. And we know that health conditions are, they can be enormous. There are n number of health conditions, and for any given health condition, you can have n number of treatment options available. The treatment option can be very fancy, very advanced, very modern type of. It can be very basic also, that can just be provided at the primary healthcare level. So we have n number of health conditions and we have n number of health solutions also. So how will the government decide which health condition should be covered under UHC, and for which condition, which type of solution should be covered within the UHC schemes? And if they go randomly, they end up spending a lot of money but not gaining in terms of health. If they go only by the expert opinion, they will they will get very like no system, and no, the knowledge will not be systematic, the information will not be systematic, it will be highly biased. Because the expert opinion will depend upon which type of expert they have reached out to, which specialty that expert belongs to. There could be bias, there could be the random decision can end up with a lot of expenditure but no gain. So for sorting this problem out, the agencies have come up that they will use the HTA as a tool for optimizing the resource allocation. So this is a judicious choice, and this gives you a very like, this is a systematic way of looking into the evidence which are available to inform the governments that these are the treatment options which are more cost effective, and if you go by including all these, you will gain this much of health by spending on these treatment options. So now the governments are taking decisions which are evidence informed. This is why we called it evidence based decision making. They are not going random, they are not going unsystematic, like just expert opinion based decision. They are now using the evidences to make a decision. Now there is a rationale behind what they are covering within their UHC scheme or not. So this is how the governments are using HTA for informing their decisions. And HTA is not just being used for informing the UHC decision. This is being used for a lot many other things also, like technology. Of course, they can assess different technologies by using HTA, but HTA can also be used for price negotiations. So when we conduct a HTA study, we get to know how much cost is being incurred by using various technology. So when you know the cost, you can have a situation where a technology is very clinically effective, but the cost is higher, and that is how you are saying that this is clinically effective but not cost effective because the cost is high. But when, if you can bargain with a supplier to bring the cost down at this extent, now your technology can become even cost effective. So this is the information that can be used for setting up the bargain, setting up the negotiations to make a cost ineffective technology into a cost effective technology. So that is also something HTA can be used for. And then of course HTA is being used for designing health benefit packages. Health benefit packages are the package with different elements within UHC scheme. So these are the bundle of services which are provided for a given health condition, and you can use the HTA information to set the boundaries of HBP, like HBP, your health benefit package for a condition. It can include the services for screening, the services for your diagnostic tests for that condition, then treatment, then follow-up cost and everything. And to decide what all elements should be there included within the bundle, they can use the HTA information that by including only this, you will be in a cost-effective situation. And if you exclude this, and if you include more than that, this will become cost ineffective. So agencies are using the HTA information to design their health benefit package also, and also to cost the health benefit packages. And the HTA information can also be used for developing standard treatment guidelines. How they are using HTA for standard treatment guidelines? Because by conducting an HTA, you know what is more cost effective, and you also know what is more clinically effective. So by using that information, you can develop the guideline that rather than randomly using the treatment options of the physician's choice, if we use only these treatment across the facilities, at least at the government setup, this will be a standard treatment option. And by using these treatment guidelines, we'll be having more help. And next thing where HTA can be used is by for developing screening guidelines. So you can use HTA to set up to develop a guideline to decide whether the screening program is cost effective or not, and if it is cost effective, at what level. Are you going to use the screening for the whole population? Will it be cost effective? Or rather, you should use the screening only for a target population, just for the at-risk population. So I remember we had HTA studies to see the cost effectiveness of screening for hypertension and diabetes, and we saw that although this is very clinically effective to screen people for hypertension, diabetes, it is not cost effective from the government's point of view. If we are screening the whole population, but if we set a cutoff value of age to screen only the at-risk population or the higher age population, then only it becomes cost effective. So HTA can also be used to screening guidelines. And because HTA is not just academic exercise, you need to implement a lot of research into the ground also. It helps a lot in implementation and operational research. And because in HTA you use a lot of patient reported outcomes, it helps to set up value-based pricing. So rather than reimbursing a company based on the claims they are making, you can say that the value the patients are gaining is this much only. So you can link your pricing to the outcome they are generating in terms of quality of life. So these are like major functions. These are the major usage of HTA, which HTA is being used for across the globe. So if we see where the HTA's role come when we say a pharma product, so we can say that whenever there is something new which is coming to your country from outside, first thing is the regulation. HTA has no role in regulation there because they'll have to look into the safety and trials and all other stuff. So HTA will not have a role there. But then comes the when it comes to the market entry, the HTA will have some role, but this is also limited to some countries. Our country, we don't have any such restrictions. Then when where HTA comes in picture in like major of the situations, like when Ministry of Health has to decide about the pricing and reimbursement, then they will come out. Then they will reach out to the HTA agency of their country to ask them that we have been reached out by this company and they are asking us to reimburse their products. What do you suggest based on your HTA information? So the HTA agency will conduct HTA study, and based on evidences, they will provide the recommendations to the ministry that whether the technology is worthy enough, whether this is cost effective or not, and whether this should be reimbursed by the Ministry of Health, whether this should be adopted for the whole population or not. So this is where the HTA comes into the picture. And then physicians can also use the HTA information to decide whether they want to go for a particular treatment option or not. And then again, the HTA information can be used when there are additional evidences available. Then the HTA agency can relook or reevaluate the same HTA study. So how all this came into picture, how all countries started to use, because in 2014 there was a World Health Assembly where a lot of countries they have resolved that they will use HTA for ensuring the universal health coverage. So many of the countries have now resolved to UHC that they will cover all their population for health services, and they've also resolved that they will use the HTA for making the judicious choice to make sure that the value they are gaining out of the money being spent is judicious. So there are a lot of countries now which are using HTA for making decisions. Some of them are using it for quite a time. A few have just joined, like India has recently started using it, and a few agencies which are worth mentioning here is NICE UK. NICE is the National Institute of Care and Excellence. This is an agency in UK. This is a very old, one of the oldest HTA agencies in the world. This was established in 1999 to reduce the variation in availability. There are a lot of treatment of it. They have NHS, which is National Health Services, and they cover the entire population of the UK. They provide every health service like free of cost. And because they are covering the whole population, they need to decide what all health condition they want to reimburse and what all treatment lines they want to use within those services. So they have set up this NICE UK. They provide the recommendations to the NHS that these are the services you must include within your packages. So based on their recommendation, they have this NHS services available for their population. There's another agency which is worth mentioning here is HITEP Thailand. HITEP Thailand is a recent, like a relatively recent organization. It's a semi-autonomous research unit under the Ministry of Public Health in Thailand, and they have done quite a lot of work in terms of health technology assessment, and they've used the technology, they've used this tool for a lot of things, a lot of price negotiations in particular, and they claim that they have saved a lot of Thailand government's money by using this health technology assessment. So there are many other countries which are using HTA like Canada, Australia, New Zealand, Taiwan, many more countries are there. But yeah, we cannot go into the details of all the countries here. So there are a few organizations. These are international organizations. These are dedicated for HEOR and HTA work. So, a few which are worth mentioning are ISPO. This is the international organization. They have a lot of HTA related activities. They have annual conferences. They have travel grants. So if you are interested, you can visit their websites and see what all services they have. They have researchers resources also. They have toolkits. They have resources around how to conduct the HTA study and many more, like not just HTA but things related to HTA also. And they have regional chapters also, not just the international thing. They have regional chapters like they have the Asian chapter, a European chapter, a Latin American. So they have the organizations and committees and like they have these mini sort of organizations in the regional level also, and they also conduct conferences for regional level also. So this is something very important. And then there is another agency called HTAI. This is Health Technology Assessment International. This is a European organization. They are a network of health technology assessment organization. They also do conduct international annual conference. So that is also a student may be interested in. And INATA is again an international organization. This is a network of more than 50 HTA agencies around the world. So that is also an organization. They are dedicatedly working in HTA. WHO, of course, is not something, they are not just doing HTA, they are doing a lot of other things stuff, but this is a very important organization. They are supporting HTA in multiple ways, and they do have a dedicated web page for HTA, and they do have a lot of resources available for HTAs, and also they do support countries which have committed to use HTA. So they provide the technical assistance and guidance. They have toolkits available for them. So this is how these different organizations are working towards these evidence-based decision making. They're supporting these type of stuff. So moving to the developments in India. So I would like to give you a brief historical overview how all this started in our country why we have even started using this HTA in our country, because during the 12th 5-year plan, there were uh, there were some questions in the parliament, and there was a suggestion that we should use cost effectiveness studies mainly to inform the clinical guidelines. That time, the clinical establishment guidelines were being developed, so there was a suggestion that we should use the cost effectiveness studies for framing those guidelines. And then there was a commitment made within the parliament to that we will establish a medical technology board, which will take up all these things under their supervision. And then there was a parliamentary standing committee that commented that because DHR, the Department of Health Research, because it's a department under the Ministry of Health and Welfare, Family Welfare, they should take up these initiative to set up this board and to start the HTA initiative. So DHR was selected as an organization to take these initiatives. And then the National Health Policy, they have also highlighted that HTA things should be used more to provide the evidence-based recommendations to the ministry's various departments for various decisions. And then the DHR came up with a note, and the Honorable HFM have it was approved by Honorable HFM somewhere during 2016, and then after that only all these activities started under Department of Health Research. Dr. Soumya Swaminathan was the Secretary of DHR and DGICMA at that time, and under her supervision we have started. So the activities started during late 2016, and then started with the recruitments and all during 2017. That was the time when we all got recruited by the DHR. So I started working for them during that time. So this was the foundation level exercise. So we had initial conferences, a lot of brainstorming how to start. We started taking the HTA requests from different divisions of the ministry, and we, because it was very new and we were not clear what HTA is and what all we can use it for, we had technical guidance. We had a lot of support from various agencies like HITEC Thailand and some people from NICE UK, and there were some other agencies which technically supported us. They actually taught us how to use this tool for conducting studies. So this is how we started at DHR. So, what is the structure of health technology assessment in India? So, health technology assessment in India is a formal structure under the DHR, as I said, and they have this three-level system. So, the first level is the highest level is an HTIN board. So, this the board is a it's a group of various people. This is headed by Dr. Vinod Paul. He's the member of Niti Aayog. And then they have members from different fields, and they have experts from different specialities. So this is the board that takes the final call on one particular recommendation. And then there is a second level of HTA, which is HTA Technical Appraisal Committee. So this committee is again a group of experts within their field. So this is a multi-speciality type of expert group where we have people from economics and medicine and social sciences and various other fields. This is the technical committee where all the proposals related to HT and all the outcome reports go for approval. So they will look into the proposal, the research methodology, the outcome, the recommendation, all the technical things related to the project. And once this is approved by them, then only it goes to the board. And then comes the third level of HTA, which is technical partners and resource centers. So they, because the DHR cannot do everything all alone, so they have set up various regional level centers and technical partners to help them conducting these studies. And then what is within DHR is secretariat. So this is where I was working earlier. Like I've left 2 years. It's been more than I think 1.5 years I left DHR, but earlier I was working with them as a scientist. So the HTA-IN Secretariat is a body within DHR under which they have experts from fields like health economics. They have people from science background, life science background, and the health economics background, and diverse like IT people for data analysis and all. And they also have interns from like MPH students and all. They work together to to. They have a lot of work like screening the research proposals and managing the work that technical partners are doing, and they also conduct the research. And then we we work to set up what are the objectives of these HTI study, why are we doing it. So we came up three objectives: that we want to maximize health, we want to reduce the out-of-pocket expenditure, and we want to reduce the inequality by conducting these HTA studies. So as I said, that HTA has established the regional resource hubs and technical partners to help them in conducting the HTA studies. So this is information. This information is around 2 year old. So by that time, they had 16 regional resource hubs and around 11. I'm sure they will have many more by now. So what are regional resource centers what HTA did? They have established state level centers so that these centers can liaise with the state government. So HTA being sitting in the center cannot do everything, cannot go everywhere. So by having regional resource centers, they have ensured that if there is any HTA related problem a state government is having, they can reach out to that regional center. So for example, IIPH Gandhinagar is a regional resource center of health technology assessment in India. So if the government of Gujarat is having any problem or any question that can be solved by HTA, they can reach out to IPH Gandhinagar expert, and they, in collaboration with the IPH Gandhinagar people, in collaboration with the DHR, can conduct a study and inform the government that that can be used for taking a decision. And what technical partners like IPH Gandhinagar can conduct that study in collaboration with the Parallel University, for example. So in that case, the Parallel University will be the technical partner. So the technical partners are not required to liaise with the governments or to take the decision, but they can conduct the study. They can be the expert in that field, so they can collaborate with the regional resource centers or through the DHR directly to conduct a health technology assessment study. So you can see all these orange dots. These are the regional resource hubs. So they have resource hubs in uh, Tamil Nadu, Kerala, Pondicherry. They have in UP, and in many states they do have, and they must have developed many more after that also, I'm sure. So this is how they have a vast network of organizations which are working in collaboration with each other to facilitate the evidence-based decision making in our country. So this is something very interesting. And let's see how HTA requests are processed within HTIN. So what happens whenever there is a company which reaches out to the ministry saying that we are coming up with this product, this is very good, and why don't you reimburse our product by within your programs and your schemes. So rather than taking a direct decision on their request, the ministry will send out a HTA request to the HTIN that we are being asked by this company for reimbursing their product. Can you please help us with taking a decision whether this technology is worthy enough, whether this is cost effective or not to be used at this large scale in our country? So the HTA will look into. First of all, the secretariat people will look into the request. They will do a kind of scoring. The scoring is based upon how if that disease is in priority or not for our country, for that particular population, if that is useful or not, if this is safe or not, like very primitive kind of information they will gain. And based on that, they will decide to allocate that topic to a technical partner or a regional resource center, and then that technical partner will come with a proposal for that product, and that proposal will be presented to the TAC committee. And if the TAC is satisfied with the methods and proposal, they will approve it. And now the HR will commission that study to that technical partner. They will provide the grants and all, and the study will be conducted. And meanwhile, they'll also consult with the stakeholders to take their inputs and their suggestions for their study. And once the study is complete, they once again present the outcomes to the technical appraisal committee, and the technical appraisal committee will decide upon approving or editing or like taking a revision for that outcome study. And finally it goes to the board, and once it is approved by the board along with the policy brief and full report, the study with the recommendation goes back to the user department from where the request has originally come for the HTA. And if there is any further evidence which is coming after some time, the HTA agency may decide to revisit their recommendation. So this is how this is the complete journey of HTA request. This is how it is processed. It can take from 6 months to 1 year, depends upon how vast the data is and how much data is information available, what all is not available, what all it is involving, what is the scope, how big is the question. So depending on that, it can take time. So what all HTAIN did so far in our country, they did completed a lot of study. I must say that when I left, they've completed around 20. I'm sure they must have completed many more by now. So they are very quick and they have a vast network. They do take a lot of requests. There are a lot of interest in HTA agencies for HTA requests from the policymakers also. They are finding them very useful for decision making. So, but the most of the studies, they were based on devices, mostly on diagnostic and screening also. And they also have conducted a lot of foundation level work because HTA was new in our country and we did not have basic things which are required for conducting any health technology assessment or any economic evaluation. Like we did not have a costing database. So if we need the costing, we did not have the studies from the literature. So for that, we needed to conduct a lot of primary studies also. So the PJ Chandigarh people, they in collaboration with the DHR, they have developed a costing database. And now if you need the cost of something, you can probably find that information from that database. So that is something very useful. And then we also did not have the quality of life tariff. So the tariff for the tariff, this is something very detailed. We can have a separate presentation on that. So in brief, I can tell you that when you measure the cost and effects, how you measure effects is by using a EQFID file form. It's a form with 5 questions, and this question generates an answer in a 5-digit format. And to convert these 5 digits into a quality of life score, you need a tariff, you need a converter. We did not have this. This is country specific. So the countries have their own, like in England have their own EQFID tariff. Thailand, they do have their own. So and you cannot, that one country cannot adapt. They cannot use the tariff of other countries because there are a lot of differences across countries and their choices and preference. So we required our own tariff set. For that, the DHR in collaboration with PGI Chandigarh and Europol Foundation conducted a comprehensive study, and by that study, now we have our own Indian EQFID tariff. So now if you want to know what is the quality of life for any particular thing, let's say if you want to know how much quality of life was gained by a person after having a polycystictomy, you can use the EQFID form for patients with gallstones and for patients who have just undergone a polycystictomy surgery. So you know the quality of life of a person who is having the stones, and you know the quality of life of a person who have just have just undergone the surgery. And by subtracting, you will know what is the health gain in terms of quality of life. By using this tariff, you can know that. So these were the foundation level studies which were very essential and which were required, and these were done by the HTIN. So now if anybody is conducting a health economic evaluation, it will be easier for them to conduct that for sure. And there were other things also which were done by HTIN. So, like when Ayushman Bharat was about to be launched, the Niti Aayog has collaborated with the DHR to review the packages which were being which were about to be rolled out under Ayushman Bharat. So DHR has supported Niti Aayog to review all those packages. And once the Ayushman Bharat was launched and rolled out, then there were a lot of speculations and requests from stakeholders to revisit the HPPs, to revisit the package, to update the packages in terms of the cost and design. So then again, Ayushman Bharat and NHA is using the information and the studies from DHR to update their packages. And HTA was also used for generating standard treatment workflows, which were being generated by ICMA at that time. And there were many other things also, which, like any question which ministry is facing and where they feel that HTA can provide a valid answer, they reach out to HTIN, and HTIN endeavor to provide them with any possible solution that can be evidence based. So these were the roles which HTA was doing for various government agencies. And we also have envisioned that we will have the HTA database for DHR. So this will be a national repository where we will have all the HTA studies listed. So anybody outside, if they want to know what all studies are being undertaken, what are ongoing, what are completed, they can have a look. So this will be available on the HTI website. So coming to, I think, what's the time? I think we're coming to close. So we can see that in summary, Apurva, are you there? Hello.
Yes. Hello. Yes.
Yeah, are we close to the end?
Yes. Yes. I think. Yeah. I think. Thank you
Okay,
very
guys.
much.
Okay, so in summary, I would just summarize
All
that
right.
we've seen that HTA is a widely used tool, and widely means it is being used across the globe. And this tool is a systematic way of analyzing what? To analyze the evidence. Evidence on what? Evidence on cost and effect. And what the evidence is used for providing the recommendations. And recommendations are used for taking the evidence-based decisions. This is why we called it evidence-based decision making. And we have also seen that India has also started its journey towards evidence-based decision making by using HTA. And I would say there is a lot in this field that is yet to be done, both like within India and internationally. So I have something for students for their career choices and their like what career options. I have kept this for the last. So I will just briefly summarize that you can choose to go. You can choose to work for the government. You can choose to work for the private organizations or academics or for NGOs. And if you want to go for the government, you have think tanks like Niti Aayog. They do use a lot of public health experts for their decisions. And again, within the government, you have funding organizations like DHR and ICMR where you can provide your services. There are implementing organizations like NHA, and there are other agencies which can also use your services for public health background people. And there are research organizations where you can choose to work for. Then there are decision making bodies like NPPA. This is National Pricing Pharma Pricing Authority, and CDSCO. So these are the organizations where you can explore the opportunities. There are endless opportunities in this field. And health economics is a narrow term. If you keep it public health, it becomes very broad. When it's public health, the health is a holistic thing. It involves social sciences. When you go to social sciences, it involves education, not just medicine and treatment. It involves like many other things like education, employment, equality, climate, sustainability, and crime and justice. There are endless things you can explore within this public health area. It depends on how you see it and what you want to do and what are your ambitions. You can choose to work for a private organization. So they do use HTA services for business development also. So there are vacancies around policy analysis. They do have a separate division of many organizations. They do have separate organizations for health economics and outcome research. They use HTA also for conducting their economic evaluation, for evidence synthesis, for contract research. You can have your own contract research type of setup where you can provide the services to smaller level pharma companies if they have HTA related questions. Of course, you can use to conduct research and teaching under the academics. And then there are a lot of NGOs you can work for, like this Bill and Melinda Gates. They're also an NGO, so you can choose to work for these NGOs. They work mostly in the field of like social impact, evidence analysis, research. You can manage their grants, you can manage their contracts. So there are n number of things you can do within this field. So it depends. I would like to take any questions, any burning questions, or if you have anything in your mind, if you want to know anything specific in this field, I would be very happy to answer. Thank you.
Thank you, ma'am.
Yes, madam. Thank you very much for wonderful presentation. I think this was, you have explained it so well in a very simple language. I think that is very helpful. So I will be moderating question and answer session without sparing much time, wasting much time. So I have received two.
Sharing.
Sorry.
Thank you so much.
Yeah. So I have received two questions from student. One is related to a career in health technology assessment. So what is the qualification required for being health technology assessor?
Sorry.
So the question is, what is the qualification required to become health technology?
Become health technology
Yes, health technology assessor.
assessor. Okay. So health technology assessment is actually a very multidisciplinary kind of work. So when they have a health technology assessment study, they need people from different backgrounds. This is never a one person job. So for a HTA study, you need a team, and the team can have people from the public health background. They can have people from clinical specialty. For example, if there is a question around gynecology, you can have a gynecologist for that. You can data analysis, of course. You need a statistician for sure. You need an evidence synthesis specialist. You need a person who is very good at evidence searching and generating the search strategies. So if you have any such thing, you can be a good fit within the team of HTA agency.
Yeah, thank you very much. So I think I would like to add also that any person which having background in public health with advanced training, additional training in health technology assessment can also work as
Yeah.
health technology assessor. Okay, thank you very much. The second question is very much related to it is a student. The question is from a student of Master of Hospital Administration. What is the implication of HTA in hospital setting?
Hospital setting, yes. For certainly, HTA has many roles in hospital settings, and nowadays big hospitals are using these HTA information for deciding what will be cost effective. So the HTA is like, you can set the restriction, you can set the boundary. So when you are conducting this for your hospital, you can set up the boundary that what is cost effective for your hospital. For your, the perspective is the hospital management, and the restriction is your hospital. You can decide this much is the budget, and you can decide within this cost, this thing will be cost effective, and beyond that this will be. So you can have the threshold of your own in this case. So based on that, you can decide whether you should go for, like for diagnostic, you can decide whether an MRI equipment will be cost effective to have it within your setup, or will it be cost effective to outsource. Whether you should have your own MRI machine, or you should use a diagnostic center's machine. You should send the patient there. So you can use this HTA information to decide on all these questions. This is very useful for
All
setting
right.
up.
Yeah. Thank you so much. And we have one question which is put up in this message is what is the difference between HTA role and HTA use?
HTA role and HTA use. I didn't get the question correctly, I think. But
Mm,
in my view, if you are trying to ask like what all HTA can be used, and I'm so sorry. I think I'm not getting. Apurva, can you?
yeah, I think I have asked. So Nazir, can you unmute yourself and please ask?
Yes, that would be better.
Yeah. Uh, I think Nazir is already there. So before Nazir comes,
Uh,
unmute. Yes, yes. Please go ahead and ask your question.
For the opportunity. In her presentation, she made mention of the role of ATA and the use of ATA, and I was not getting the difference between the role and the use. So I wanted to know what's the difference between the two. Thank you.
Yeah, sure. Like HT can have a role in many different things, but how you use it depend on your own requirement. Because, for example, for a country, like HTA is just a tool. It will not be used automatically. It's a tool, and you will decide. You can decide how all you want to use it. It can have a role in market entry of the product. It can have a role in regulation also. It can have a role in reimbursement also. It can have a role in clinical usage also. But the country level, at the country level, we are the people, we need to make a decision as a government or as a user that where all we need to use it. So the roles can be vast enough, but the use can be restricted. It can depend upon the choice of that country. So this is the difference.
Okay. Hope Nazir, your question is answered.
Yes,
Yeah.
this is Samuel. I have to use the phone because I was shopping. This is Samuel from Ghana. Thank you.
Thank you. Great. So we have another interesting question from Joe. Why is it taking too long for country to adopt HTA? During COVID-19 pandemic, many countries developed local remedies to reduce COVID-19 morbidity and mortality. Would this be of value to a developing country like Uganda?
Very good question. I would say that first thing, there are two separate questions. First, why countries are taking long in adopting. So, as this is very simple. Like as already known by most of us, that as WHO DG once said that UHC is a political will. It's not just a thing; it's a political will. It's like if the policy makers, if the takers of the country, they decide to use something, they decide to do, they can do. It's a political. So HTA is also a political will. If the government want to use, even if they have HTA agency within this country, within their country, they can decide to use or not to use the recommendations which is being provided. So the role of HT agency is to just provide the recommendation, but they cannot decide whether it will be used or not. This is certainly a choice which has to be taken by the policy makers. So this is a political will when people decide, when people start to use that, and at what level they want to use that, and for what all they want to use that. So this is a choice based
Yeah.
decision in particular.
Yes. Hope this answer has helped you. I think we have few more questions, but considering the time, I would need to stop question and answer session here. If I receive many more questions, I will certainly forward these questions to you, and will try that these questions are answered and send it back to students. So hope that is fine. So okay, there is one.
Yeah, I can see the practical demonstration. Nazir, the practical demonstration, it can take a week or 15 days or maybe a full year to practically demonstrate how to conduct. The best way is that maybe your university will have a practical workshop so that you can have some hands-on training. They can even choose to conduct a hands-on workshop for a week or so where you can learn more about the specific techniques. So there are the costing technique, the quality of life studies technique, and the modeling things, all that. So this involves a lot more, which is beyond this webinar at least. So you can have a
Yeah.
separate hands-on training for that.
Yeah.
That
Yeah,
can
and certainly I'm happy to share that health technology assessment is one of the elective as part of Masters of Public Health program. So we'll be having uh, you know program, I mean course on health technology assessment. So in during that we can integrate practical
sessions.
assessment or practical sessions on
Yeah.
that. So perhaps that will be very helpful. So that will happen in next academic year. So on behalf of Paro Institute of Public Health and Paro University, I would like to extend my heartfelt thanks to Dr. Salu Jain, who agreed to spare your valuable time, because I know you are very busy, and from busy schedule sparing a time is very tough. So thank you very much for coming here and sharing some time with our students. I think your session was wonderful, and at least it has provided some information and some insights on health technology assessment, and I believe that it will be very helpful for our students to orient themselves on it and train themselves on health technology assessment field. So as a token of appreciation, I would like to share a certificate of appreciation for you, and usually we share that certificate on webinar so that you can have a look at it. So
Oh,
uh,
wow, this is
thank
nice.
you. Thank you very much. And we'll stay in touch and we'll keep interacting with each other. And if there is any opportunities where you can share your professional experience, we will certainly contact you. I would
Thank
also like to extend thanks to all my students of Paro University, students of Paro Institute of Public Health, for be available at this time. And many of the students are from different countries who are perhaps in their country and in different time zones, and still they made themselves available for this webinar. I really appreciate that. And all students who are here and from different places, because our students currently are in internship, so many of the students are joining us from their respective places. So I really appreciate for their time. I also thank my faculty members who are there, who are constantly encouraging our students to take part in such webinar series. So thank you very much. And last but not the least, our technical team of PU webinar, who are always there to help us and organize such webinar series. So without their help, we could not arrange this webinar series. So thank you very much to all of you who have contributed in making this webinar a success. So with this, I would like to conclude today's webinar. Thank you very much. Till we meet with the next webinar. Take care of your health. Take care of your family members. COVID is still there, so protect yourself and your family from COVID-19 and take all precautions. Thank you very much.
Thank you. Thank you so much, Apurva. Thank you.